I just love having rational conversations that are based on fact, exposing the truth, getting away from the narrative and all the nonsense that we have to put up with on a day-by-day basis. Connie Mulder is the head of Solidarity's Research Institute, and he's a man who goes straight to the heart of the matter. Last time we spoke, it was about the state of emergency that Cyril Ramaphosa wanted to impose because of the electricity crisis. Connie unloaded exactly what was happening there, and well, we'll find out how that all worked out. Today, though, we're talking about national health insurance, if anything, the hottest topic of the moment. Connie, thanks for joining us. Maybe let's start off with the our last conversation, your court action against the government on the proposed state of emergency. If I recall from, well, it's easy to recall because I can go and read the transcript and listen to the interview. You were very worried that government would be using this as an excuse to once again impose the type of state of disaster that they did during COVID and an abuse of the system, in your opinion. How did the court action go for you?
Well, Alec, it's one of those paradoxical things where the court action went very well in that we didn't actually have to go to court. Simply put, when the court date was looming and government needed to file their response, they wrote us a letter stating that they will withdraw the state of disaster if we then withdraw our court case. And then we answered the normal answer, which is, okay, the moment you withdraw it, then there's no use in going to court. And shortly after that, you might recall, they then terminated the state of disaster prematurely, which is, for interest sake, exactly how the COVID state of disaster ended as well. Is they were on their way to get a bruising in court, and they knew they were going to get smacked around. In this case, especially, I don't know if we mentioned it last time, but in their answering affidavits, in their discovery, they attached several emails in which their own counsel, 2 days before the state of disaster, explicitly states, this is completely unnecessary. We've got the legislative instruments. This won't hold up scrutiny in court. And they still went ahead and went that way. So in the letter, for interest sake, they asked us to withdraw, and they then offered to pay all our legal costs as well if we withdraw. And that has since happened. South Africa's not in a state of disaster officially regarding electricity. It might feel disastrous, but the legislative instrument has been taken out of their hands.
It's extraordinary the way that politicians use other people's money, in other words, our money as taxpayers, to pursue these not vendettas, but these crusades, which actually aren't and make absolutely no sense. And I guess you're going to argue the same way with national health insurance, and we're going to go through exactly why. But this has been on the table a long time. When did the Research Institute start investigating and start researching it?
So this has been on the table for almost 20 years now. We started, I started at the Research Institute in 2017, and that's when we started when I started at least, on the NHI. And it's been a constant struggle to get literally just basics out of government. We thus far, I think we're the only ones who actually did a costing as part of our parliamentary presentation and as part of our court documents, to say what will it cost. Government has to this date not done a proper costing. We have no idea. We still don't know. We've sent access to information applications, but we don't know what it's going to cover. They cannot state what is NHI actually going to cover. And that means now the debate has heated up, but it does every now and then, with government now forcing this bill in its limp and truly horrid state, which is several gaps. No one knows. No real costing model, but they forced it through Parliament, which means it's now going to the NCOP, and then the President needs to sign it. So just for listeners who might not know, the NHI is government's initiative to basically implement one central medical aid that everyone in the country belongs to, and that is funded by tax money. And this will then be a central procurer of all medical services. Thus, doctors will be contracted to this fund. Every doctor will need to work for this fund, and government will then determine what you can get as a medical service and what it's going to pay a contractor or a doctor for that medical service on your behalf. All of this administrated centrally and then funded by tax money, with the one caveat explicitly stated that private medical aids may not cover anything that the NHI covers. So that's why it's very important what NHI actually covers, but they just can't tell us. They're saying, no, it's going to be staggered, but they won't tell us. So from our perspective, this is a massive existential problem. Is you're going to ESCOM healthcare. That is exactly what's coming. And that is why, well, we can go into that, but we've been vocal critics repeatedly, and we've actually we did our parliamentary presentation in the form of court documents to send the message quite clearly that if you go ahead with this, we will be heading to court immediately. This piece of legislation is in dire straits in terms of plain rationality. It doesn't make any sense. We will stop this using the legal system.
Why is it left to you to do this? And I ask this because the vested interests of medical aid companies like we know all the names, Discovery, Momentum, Liberty, and the private hospitals have to be even far, far greater than Solidarity Research Institute's view on this. And yet you, the guys who are making the running.
Yes, Alex. So we're not alone in this. However, several of these private hospital groups have indicated that they will be opposing. But the difference being is we're not that in bed with government. In fact, they don't like us that much, but it's reciprocal. We don't like them as much either. So that's fine. Now, we've repeatedly stated we don't like the government, but we do love the country. And that is why we do a lot of these things. Medical aids and especially healthcare is a very regulated environment. And angering the health department isn't good for business for any of these medical aids. There's a lot of loopholes that can be closed or regulations that can be imposed that would have severe impact. On the one hand, I think medical aids like Discovery are of the impression that they will be the ones administering this big fund. Government has stated that's not the case, but it's plain as daylight the government does not have the capability to do this. So this will most likely end up in a massive tender that somebody will have to get to actually administer it. From our perspective, the reason we're busy with this is quite simple. Our members overwhelmingly have private medical aid. This is an unfortunate circumstance for the simple reason we would like public healthcare to be at a place where you can actually use it. I was born in a public health hospital. I'm assuming you were born in one as well. Public healthcare was of an excellent standard in South Africa, and it has been mismanaged into the ground, and we would like that to return. But NHI is not the way. What we're seeing, what's going to happen to NHI is not that the public healthcare will be pulled up to the private healthcare sector. The exact opposite is the private healthcare sector, which is still excellent at really providing excellent medical health, medical cover, will be pulled down to the public healthcare sector. And this is for the simple reason that the people who are going to run it are the same people who ran ESCOM into the ground, who ran the post office into the ground. It's the same ideology, it's the same idea of central planning of healthcare, which barely works in developed countries that have gotten it to work. If you look at what the NHS, with all those problems Britain is facing, but we foresee that there is absolutely no chance of that working in South Africa. It will only destroy the private healthcare sector. It won't actually fix any of the fundamental problems in the public healthcare sector.
So you're going to court. What exactly are you wanting the court to rule on?
Well, from what we're sitting, there's two aspects. The one is the constitutionality of this bill. Is the department plays a bit of semantic gymnastics with us, saying everyone has the right to healthcare. Now, that is not actually what the Constitution says. The Constitution explicitly states everyone has the right to access to healthcare, and it doesn't state what quality that healthcare should be. So, on a cynical route, that right is already encapsulated or realized in the public healthcare sector, where anyone can show up to any hospital at any point and say, I need healthcare. So that right, it's already realized. It's not that they're realizing a right that's not realized. It's very technical, but it basically means we've got a public healthcare sector. You can show up. We'll talk about what's going on in the public healthcare sector and why we're of the opinion we should rather fix that. So on the one hand, that. On the other hand, it's just on rationality, which says, what is the rational reason for implementing something? From what we can see, this is a money bill. It's going to cost a lot of money. I think we did the math last year. You're looking at roughly about an average taxation increase. If they use the personal income tax surcharge they would need to add 20% to your income tax percentages, 20 percentage points. Or they would need to lift VAT to 20% as well, 15 to 20%, or increase company tax from 28 to 42%. They're talking about a payroll tax, which I have no idea why. That's just not. It's not. But it's the whole payroll will be taxed, and then after that, of about 5.5% as well. So we're talking about massive increases in taxation to be able to fund this. And if we're talking about those levels of increases, given South Africa's economic outlook, it's not rational. On the one hand, it's completely unaffordable. On the other hand, it's unnecessary. We already have a public health sector. We spend billions in terms of percentage of GDP. We spend more than most developed countries on our healthcare sector. Now, if we get bad health outcomes, that doesn't mean we need to spend more. And I use the example saying, if I send my son to the grocery store and say, you need to buy bread and milk, and he comes back with M&Ms and he spent 100 Rand on that, then the answer isn't to give him 200 Rand and say, go back to the store. The answer is to make sure that someone else does the shopping. And that is what we're seeing here is we've got a public healthcare sector that shops very badly. They spend millions or billions of Rand for extremely bad health outcomes. And the government's answer is, well, we just need to give them more money. That doesn't make any sense. It doesn't compute. The private healthcare sector shops much better, and government is now saying, well, you guys are spending your money wisely, but that's not something that we want in South Africa. We need you to come in, and then we're not going to fix the public healthcare sector. We're just going to throw more tax money on it. And then surely if we start spending 8 or 16% of GDP on healthcare, then there has to be better outcomes. But it's not that simple when you're dealing with a fatally flawed, systemic corrupt public healthcare sector, which is why we are where we are.
Who put this whole bill together? And the way you've explained it is rational, logical. We know the consequences of socialism pretty much everywhere in the world. Here in South Africa, it's in your face because of the inability for the state to deliver, and we know that with SOEs, as you spoke about Eskom. Do we need to be reminded? But who's actually driving this? Where does this whole, what appears to be fantasy land, come from?
It's been a long time coming. The first committees of inquiry into NHI was started in 1995, actually. At the moment, however, it's the Ministry of Health that's driving it. I think it's Dr. Nicholas Crisp being the main appointee who's trying to get this bill through. But it started, the irony is there were several committees of inquiry, as well as Social Security, the Taylor Committee of Inquiry, the Committee on the NHI explicitly, and all of them found that it's unaffordable. But that has never stopped a socialist. So what we're seeing is we've got the Department of Health, and in this case, the only thing that makes sense to us is this is a desperate attempt to tick a box because this is part of the ANC's policies. They should be implementing NHI. It was once again discussed at NASREC in the policy conference last year that they need to make haste with implementing NHI. And that means it looks like it's sort of a tick box exercise to say, all right, we've now gone ahead. Especially when you've got legislators who say, well, we've implemented it, but don't worry, it'll only take effect in 15 years. And the question is, well, what are you doing exactly? Why are you trying to destroy healthcare at this point? It doesn't make any sense. So it's purely political reasons. Currently, they surely know a bill of this magnitude, as Minister Pachla correctly stated, it's the most revolutionary bill that Parliament has passed to date. It has to be watertight, and this thing isn't. It has severe shortages. It doesn't have a proper costing model. All of those things. It's going to get most likely bumped. Well, we say almost done, but it's going to lose in court almost immediately, and there's going to be several court challenges. And that's the part that puzzles me, is why the ANC knows exactly. We told them we're going to go to court the moment you pass this. Why didn't they then go back and try and make it watertight and pass this leaky bill that's not going to do anything else than score them a bit of political points until the courts overturn it? But that will most likely only be after next year's election. So the cynical part of me says it's a short-term political ploy. Unfortunately, it has long-term consequences on morale of healthcare workers, as well as the certainty of, are we still going to have a job? As simple as that, from our members in healthcare who don't know if they're still going to have a job when NHI comes through.
I think we've all got our stories, but I've certainly been on aeroplanes traveling internationally where people from South Africa have gone to the UK to benefit from their national health insurance or NHS sector that they have there. But that's expensive. You've got to get a flight. You've got to have a passport. You've got to get a visa. Once you arrive there, of course, you can use the system. in South Africa, one just thinks logically, we have porous borders, we have lots of illegal immigration. If you have free healthcare in this country, which is presumably what the ANC is aiming for here, um, it would accelerate. One would expect the movement of people from to the north of us, with all of its knock-on effects. I wonder if these kind of issues, these kind of practical issues, have been put on the table.
It's been put on the table, but there's been no heed paid to it, no attention. Government just doesn't believe that that's going to happen. So just one caveat is that there's actually no such thing as free healthcare. Someone pays. In the UK, it's just tax-based healthcare. So you don't pay with it directly at the doctor, but you do pay for it every month in your tax money. In South Africa, it's the same situation. Taxpayers are going to have to pay for this healthcare. But once we go to free healthcare, we've already got free healthcare to a large extent, and most indigent people, if you're below a certain income level, healthcare doctors cannot charge you at the public hospitals. You will be helped for free to a large extent, especially if you're going into trauma or emergency situations. So that is why we've got the problem of immigration at the one point. But if we try and expand it, and that is the promise that the ANC tries to sell, and it's really cynical to sell this to desperate people. They're not telling them you are going to be able to go to a private hospital and get the best private healthcare without paying a cent for it. Now, this is a dream. It's not going to happen. We've seen what happens to countries with our income levels that do implement this, and that is you will have Cuba's healthcare system, which is free. You can absolutely stand in the queue and then die in the queue for free. You will not have to pay any money, but you will not necessarily actually get healthcare. These things don't work together. What we've proposed repeatedly is South Africa has a public healthcare system. We are spending billions of rands on it. If we're not getting good outcomes there, then surely the start is to say, let's fix public healthcare. And the moment you get a situation where public hospitals actually get clean audits, public health departments get clean audits, and we've once again started reaching the health outcomes that we need to in public healthcare, then we can have a discussion about, is this sufficient or not? But at the moment, we've got government who's mismanaged public healthcare and now wants to go bigger. So the allegory I use is, this is somebody who's driving down the road in a car, and then they hit every single obstacle, every road, every speed bump, hit a couple of other cars, and then when they stop, they get out and they say, yo, you know what I should be doing? I should be flying Boeings. And that is exactly what this is. If you can't get our current public healthcare system right, and that is because there's no proper oversight. We've got systemic issues with providers, just plain stealing. We've got crooks in there. They're still going to be there. You're just going to increase their funding with this new system. And we don't foresee anything good happening in that aspect. We're not of the opinion that healthcare at the moment is in a good state in South Africa. Don't be fooled. We're not going to sit back and say, well, you guys can die outside. We'll eat our cake in here. This is not where solidarity is at. We're saying we need to fix public healthcare. We need to do it very urgently. But the way to fix it is not this. It's not destroying private healthcare, which still works, and then throwing more money at a corrupt system. This is not going to fix the situation. What we need to do is fix public healthcare whilst maintaining private healthcare, because private healthcare is sort of the one shining example. And there are several proposed solutions. The one is force medical aids to have a very low income option, which the government then can subsidize for poor people if necessary. That would enable, it's sort of almost a voucher system, but that would enable people who don't have access to private healthcare at the moment to use the competitive forces of the market and to use a wallet bigger than their own, to use a government budget to get access. But that entails keeping private medical aids and allowing people choice, giving private medical aids the option to use competition to drive down costs. All of these things which make sense from a community standpoint and from an economic standpoint. Not having one big central fund that has failed almost everywhere. It's been implemented. That leads to what we've seen. It's going to lead to massive wait times. In the UK now, the last time we checked, you had an almost 2-week wait time to see a GP if you apply. Now, this is a first world country with a massive tax base. South Africa is going to be in a situation where you'll have to see GPs illegally in dark alleys, and people will be curing headaches in dark ages. This will be the new illegal situation, which is what happens in Cuba. Is you've got pharmacies that sell normal drugs, but do it on the black market, and that we don't want to go there. We don't need to be there as a country. There are several things we can do to fix this before trying to rebuild, to basically burn the house down and then believing we're going to build it back from scratch.
Well, at least we do have a legal system which enables us to have these kind of legal challenges. So more strength to your elbow, Connie Mulder. Thank you for sharing the rational perspective of the National Health Insurance proposal. How those politicians believe that they're going to change things this time is beyond most logical brains, but who knows what's going on in their minds. Perhaps it is just a political ploy. Connie Mulder is the head of the Solidarity Research Institute, and I'm Alec Hogg from biznews.com.